Hello, and welcome to this HCP Live Peer Exchange, Advances in the Management of Peripheral Arterial Disease. I'm Dr. Deepak Bhatt from Brigham and Women's Hospital and Harvard Medical School, and it is really a pleasure for me to introduce some great friends to discuss the contemporary management of peripheral artery disease. Today, I'm fortunate to be joined by Dr. Mark Bonaca and Dr. Mike Gibson and Dr. Matt Menard, all of Harvard Medical School, and Dr. Manesh Patel from Duke University. So before we get started with what I hope will be an interesting program, it would be sort of colorblind and tone deaf of me to not acknowledge the fact that we are filming this in the middle of an epidemic, an unprecedented epidemic that none of us living have ever experienced before. Really an incredible human tragedy, but at the same time, a remarkable story of people banding together, in particular those of us in healthcare. So maybe I can just get each of you to opine about your thoughts about the COVID-19 epidemic, what you personally are doing or are doing in your healthcare system, and then specific to today's topic, for those patients with peripheral artery disease or cardiovascular disease more broadly, any specific advice that you're giving to your patients. Let me start with you, Mike.
Yeah, boy, it's been a rough time. I think anything we say about the epidemic today may be different tomorrow. So things are changing so quickly. The science is evolving so quickly. It's hard to really say a lot. I will say personally, as I've talked to you, Deepak, I was out for a month, flat on my back, barely able to walk across the room, short of breath, still coughing a lot. I had ARDS when I was 33. I didn't ever get tested because the hospital said it would take 3 weeks for the test to come back at the beginning of the pandemic, and I was told to stay home. My daughter-in-law has it. So I think all of us will have someone who touches us with this disease. It may touch us personally, but I just hope everyone stays healthy and well.
Yeah, no, thank you so much for joining. And it's an incredible story with you and with your daughter-in-law and your son as well. It's just, it shows us that COVID-19 is touching all of us in very personal ways. I really wish you and your daughter-in-law the best. And, you know, it's interesting you mentioned that you had ARDS when you were 33, but, you know, now that you're older at age 35, it's a lot harder to recover from those sorts of illnesses. So
yeah, it's tougher at 35. Yeah.
Yes, I wish you the best. Well, good. Maybe we can see what Mark Bonaca thinks about COVID-19. In particular, what are you doing with your large number of PAD patients?
Yeah, thank you, Deepak. And I'll just share in that this is an unprecedented time. We hope people are healthy and safe. And I think as many of the folks in the front line are struggling with how do we care for patients, obviously our units are filling up with COVID patients. But I think to your point, Deepak, there are important ramifications in a couple of ways. One, there's a prothrombotic state associated with COVID. And so I think the risk of thrombotic complications like VTE and actually acute limb ischemia, there's some reports coming out. Those are much higher now we're seeing in COVID infected patients. And the other issue is trying to keep our folks out of the hospital. I mean, we are trying to do everything virtually for our vascular patients, and the need to come back for recurrent procedures, for other issues, is a real problem because we don't want them to get infected. It's a very fragile population. So we're trying very proactively to really embrace strategies that keep people healthy and away from the hospital while we're trying to keep people with COVID supported.
No, that's terrific. And, you know, I've got to say, I always think of you as part of the fold and family here. But I think I introduced you as being with Harvard Medical School. And of course, now you're at the University of Colorado and running the academic research organization out there, CPC. How are things out in Colorado in general right now with respect to COVID-19?
Yeah, well, it's very much, I think, like what you're seeing in Massachusetts. We're not in a sort of New York situation yet. Like Mike said, it's changing day to day, but we're really increasing in the number of cases quite dramatically. And because of some of the resorts and sort of the travel in those areas, although the populations are low up in the mountains, there's very high rates of COVID. So, we expect to see sort of the spike through the mid to end of April, probably like you're expecting too, and the units are filling up.
Yeah. Well, Matt, what are your thoughts on COVID-19? I've seen you've still been doing some critical limb ischemia cases in the cath lab, so you're obviously still busy and taking care of folks, as of course you must as a vascular surgeon when emergencies come up. How's all this affecting you and your practice and your patients?
Yeah, thanks, Deepak. And just a word, Mike, it's great to hear of your full recovery in your ordeal. But it's certainly been disruptive, as it has across all disciplines. You know, we get kind of daily briefings on kind of important triage decisions, and there's certain subgroups of patients that we see, dialysis patients, but particularly PAD patients, where the decisions are pretty tough. As Mark mentioned, we're making a lot of effort to keep patients out of the hospital. Certainly all elective and even semi-elective cases have been canceled, and it's really the most vulnerable, the sickest critical limb patients that, you know, obviously time is of the essence. So still doing those as needed, and but a lot of tough decisions as we try to sort out, you know, how to best use our resources. And the operating rooms, many of them have been repurposed for ICU care as well. And so, as you said, everyone's sort of pitching in and kind of doing everything they can.
Yeah, no, it's really wonderful, and you're doing a great job there on the front lines. And we're also joined by Dr. Manesh Patel, although he actually got called into the cath lab at Duke for an emergency coverage sort of situation. Just shows how unpredictable the life is right now of doctors and nurses, where you can get called into action at any moment. Excellent. Well, thank you all for your thoughts on COVID-19. Really valuable, I think, for our audience just to hear the human side of the toll this is taking.